Hi, I'm Andy, social media manager here at DHCS. Um, I'm going to quickly go over our TikTok account just to kind of show you all what you can expect to see on there. And also, maybe if you didn't know, that we do have a TikTok account. So, this is what you'll see if you look up Medi-Cal underscore DHCS. Um, we have lots of videos on here, all explaining benefits or bringing awareness to different observances or just topical content. I did want to briefly show you, we do have a new doula video that we posted last month, and I wanted to just kind of quickly show that as well. A little bit more how doulas work during pregnancy, birth, and postpartum.
Yeah, we provide emotional, informational, and physical support throughout the spectrum of pregnancy, birth, and postpartum. During pregnancy, we provide information, advocacy. During birth, we provide comfort measures and reminders of advocacy and advocating for yourself during the birthing process. And in postpartum, we provide support during recovery and feeding and lactation support.
Why is it important for parents to breastfeed their child, not only for the baby, but for Manhattan as well?
Yeah, so we help with support, lactation support. We help with positioning and latch. Those early days are really important for your breastfeeding and your nursing journey. It's beneficial to baby, but it's also beneficial to the lactating parent. It does help with recovery, and it helps promote that emotional bond between them.
What are some common challenges?
So that's just a quick snippet. If you want to see the full video, please go visit our TikTok and give us a follow. Like I mentioned, we've only had it up for a few months now, so we'd really appreciate some more followers. Additionally, we have some back to school content, letting people know that, getting their children in for checkups and get up to date on their vaccinations and shots. So like I said, highly recommend you all checking it out. And we're also open to collaborations. If you'd like to collaborate with us, you can email me at social.media@dhcs.ca.gov. I'll drop it in the chat as well. But thank you.
Andy, for sharing our DHCS TikTok page. That can be a useful tool for our coverage ambassadors. We will now move on to our next presentations for today. First, we will have Claudia Chavez from DHCS present on breast and cervical cancer treatment program. Then we will move on to Samantha Frazier, also from DHCS, who will be presenting on presumptive eligibility programs and the newborn gateway. Claudia and Samantha, before you begin each of your presentations, please introduce yourselves.
Okay, thank you, Isabel. Good morning, everyone, and thank you for having me. My name is Claudia Chavez, and I am the unit chief for the Breast and Cervical Cancer Treatment Program with the Medi-Cal Eligibility Division. I'm here to present information about what is BCCTP. Can we get do we have the slides going? Sorry about that. I may have started a little too soon.
No, you're fine. They were just brought up. Thank you.
Okay. So today I'll be sharing with you information about BCCTP, the eligibility criteria, levels of coverage, and how to apply. And like Isabel mentioned, after me, Samantha Frazier will present the other information about presumptive eligibility and newborn gateway. Next slide, please. We'll go to the next one. And a little bit of background on BCCTP. It provides no-cost Medi-Cal to low-income individuals diagnosed with breast and or cervical cancer that have been identified as needing treatment. Treatment is also available for some precancerous conditions. Every Woman Counts and Family Pact programs provide breast and cervical cancer screenings and diagnostics. When an individual is diagnosed with having cancer, EWC and Family Pact qualified enrollers submit a BCCTP application online at the doctor's office. To be eligible, EWC and Family Pact screen individuals meeting these 3 eligibility criteria, which are to be diagnosed with breast or cervical cancer and need treatment, that they are California residents, and that they have income at or below 200% of the federal poverty level. If an individual meets that criteria, then they can pursue treatment as long as they need it, and that they do not have a lapse in coverage. Individuals can apply for BCCTP one of 2 ways. They can go through EWC or Family Pact, or they can ask their county eligibility worker for a referral. There is a process in place from county to state. There are also 2 levels of coverage for BCCTP. We have the federal BCCTP, which provides full scope Medi-Cal, which includes cancer treatment. This level of coverage is for individuals that meet citizenship, immigration status, and age requirements. For state BCCTP, is coverage limited to breast and cervical cancer treatment and related services. This level of coverage is available for individuals without citizenship or immigration status and are of any age. It also covers individuals with other health insurance like Medicare, Covered California Plan, or private insurance. Next, please. BCCTP presumptive eligibility. At the doctor's office at enrollment, when an EWC or Family Pact provider submit an application, BCCTP PE are immediate temporary benefits that provide access to care and treatment at no cost for BCCTP applicants up to 60 days. BCCTP PE allows individuals to initiate treatment while county and BCCTP Medi-Cal applications are processed. And those individuals that are eligible have to meet those 3 criteria in the bullet points. They must not have had other PE in the last 12 months. This also includes HPE or hospital PE. That they are uninsured and that they are under the age of 65. Next slide, please. This is a breakdown of how EWC and Family Pact enrollment for BCCTP PE happens. At the doctor's office, the EWC or Family Pact provider submits the BCCTP application online. PE will be granted to the applicant if they meet the eligibility criteria and then can initiate treatment. The applicant must apply for county Medi-Cal while on PE. The county eligibility worker will complete a determination of Medi-Cal eligibility. If the applicant does not complete a Medi-Cal application, then the PE will end. The applicant at that point, if they do not apply for Medi-Cal by the end of the PE period, they must reapply. If the applicant completes the Medi-Cal application, then MCED will make a determination of eligibility for both federal and state BCCTP, whichever is most beneficial to the applicant. Next slide, please. To reach as many individuals as possible, BCCTP has a safety net. It's a process with the counties, and here to our right is a flyer that it is included in Medi-Cal renewal packets. We understand that not all individuals have a physician through EWC or Family Pact, and this is our way to try to reach as many individuals as possible, or just to bring awareness of our programs. If an individual does not have full scope Medi-Cal or becomes ineligible at any point, the individual can request a referral to BCCTP. From our end, the state consultant will review any medical records and determine if the individual has a qualifying diagnosis of breast and/or cervical cancer. Next slide, please. These are resources that are available. This is our contact information. And also, if you know of someone that could benefit from free breast and/or cervical cancer screenings, this is EWC and Family Pact's contact information. And also, if just want to say thank you for having me again and bring awareness of BCCTP. And if you have any additional questions, those can be answered at the end of the, and I'll be glad to assist. Thank you.
Hello, everyone. My name is Samantha Frazier, and I'm one of the analysts who works with Presumptive Eligibility and Newborn Gateway here at MCED. Medi-Cal Eligibility Division, and I really appreciate everyone being here today. So let's get started. DHCS, we run several presumptive eligibility programs whose purpose is to provide uninsured individuals with access to temporary coverage for services needed right away. So you did just hear about BCCTP presumptive eligibility, and I'm going to cover 3 additional programs, which are children's presumptive eligibility, hospital presumptive eligibility, and presumptive eligibility for pregnant people. These programs have been in place for a while, but some may be unfamiliar with this resource, so ambassadors can help by raising awareness of these programs to anyone who they believe may benefit from them. So the key benefits of presumptive eligibility are that determinations rely solely on self-attestation of key information. So this means that no proof or verification is required. Our presumptive eligibility programs also use simplified applications which have only a few questions. And lastly, coverage is granted in real time for services needed right away. So when someone applies, they'll know then and there whether they have temporary coverage or not. Next slide. We're going to go over the specifics of children's presumptive eligibility now. Can everyone hear me? Can someone give me a thumbs up?
I can hear you, Samantha.
Great, thank you. Great. So for children's presumptive eligibility, families provide key information about their child and family circumstances. So to qualify for children's presumptive eligibility, these things need to be true about the applicant. They are under the age of 19. They are within the income limit for their household size. They are a California resident. They don't have Medi-Cal, and they have not exceeded 2 presumptive eligibility enrollment periods in the last 12 months, so children can receive presumptive eligibility twice per 12 months. Next slide. We're going to go into the specifics of hospital presumptive eligibility now. So same as children's presumptive eligibility, applicants provide key information about themselves and their circumstances. To qualify for hospital presumptive eligibility, these things must be true about the applicant. They are within the income limit for their household size. They're a California resident. they don't have Medi-Cal, and they have not received PE more than the maximum number of times allowed within the past 12 months. When pregnant, they have not received presumptive eligibility during their current pregnancy. Next slide, perfect, thank you. So there are several different hospital presumptive eligibility groups which cover individuals of every age. So whether the applicant is 1 day old or 100 years old, there is a coverage group they may potentially be eligible to. This chart shows how often someone can enroll. So children can receive presumptive eligibility twice per 12 months, adults once per 12 months, and pregnant people once per pregnancy. Next slide. So next we'll discuss the specifics of presumptive eligibility for pregnant people. So presumptive eligibility for pregnant people also provides immediate temporary coverage. However, services are limited to outpatient prenatal care for conditions related to pregnancy. Because coverage is limited scope, it's really important to apply for Medi-Cal and fully enroll to receive coverage for all services. And these are some of the things that are covered and things that aren't covered. Okay. So same as our other two presumptive eligibility programs, applicants provide key information about themselves and their circumstances. These must be true about the applicant. They are within the income limits for their household size. They're California resident. They don't have Medi-Cal, and they haven't received presumptive eligibility for their current pregnancy. So a lot of overlap. Next slide. Next, we'll discuss who enrolls people into presumptive eligibility. So healthcare providers who can make presumptive eligibility determinations are known as qualified providers. So just because a provider, a facility, an organization participates in Medi-Cal doesn't mean they are a qualified provider. Qualified providers are specifically approved to make these temporary eligibility determinations. The qualified provider lists are published on our DHCS landing pages. Each program has its own qualified providers, though some may participate in multiple programs. And details on how to find these lists are located in the resource section of this presentation, and we're going to go over those later. And just to flag, sometimes presumptive eligibility won't be available during a visit. This is because not every staff member is trained to submit presumptive eligibility applications. So if you're visiting a qualified provider, but a staff member isn't available to take an application, it's really important to apply for Medi-Cal and complete that application process. And we do recommend doing that within the same month as the service is to ensure that that visit will be covered. Next slide. All right, so next we're going to shift away from presumptive eligibility to cover the Newborn Gateway. And this launched in July of 2024. So Newborn Gateway requires qualified providers to report births of infants who have linkage to Medi-Cal or the Medi-Cal Access Infant Program. Qualified providers must report infants who are born in their facilities, and they must do so within a specified time frame. Next slide. The Newborn Gateway is an electronic application, and it's used by qualified providers. It will establish eligibility in real time, so it'll establish right away. It will assign baby a unique client index number, a SIN number. It will generate a temporary benefits card known as an immediate need card. It will mail a benefits identification card. So it'll mail out a BIC card as well, and it will notify the case management entity of baby's birth. Next slide. So ongoing coverage. The case management entity, whether baby ends up in Medi-Cal or the Medi-Cal Access Infant Program, that case management entity is going to be notified of baby's birth, and they're going to mail out an approval letter. The baby is going to be deemed eligible, which means they're going to remain active on Medi-Cal until their first birthday. So unlike presumptive eligibility, which is temporary, Newborn Gateway is going to get baby into coverage long term. Next slide. Okay. So next we're going to discuss some resources for presumptive eligibility and Newborn Gateway. So this is a breakdown of presumptive eligibility at a glance. As you probably noticed, there's a lot of overlap in the presumptive eligibility requirements. However, this shows that income limits, scope of coverage, and enrollment frequency depend on the coverage group. So it varies depending on if you're an adult, a child, or if you are a pregnant person. I'm going to give you few seconds to take a look at this. This resource will be shared, but just to get a sense, residency, same across the board, can't have Medi-Cal, same length, but then sort of the scope for pregnant folks, again, limited, adults, full services. All right, next slide. So scope of coverage. Presumptive eligibility for the programs we're discussing provides full scope coverage for all coverage groups except the pregnant group. So pregnant individuals will only receive coverage for specific services, which are limited to outpatient prenatal care for conditions related to pregnancy. And just to note that the services covered by hospital presumptive eligibility for pregnancy and presumptive eligibility for pregnant people are the same. So if you apply for one, you're not going to get different benefits when you're pregnant. Next slide. So presumptive eligibility offers valuable coverage for uninsured individuals who need services right away. But ambassadors should be aware of some limitation in how they can be managed, and that's shown on this chart. The takeaway being that individuals should apply for Medi-Cal and complete the application process. So for pregnancy, coverage is limited scope, so you want to apply for Medi-Cal to get that full scope coverage. And presumptive eligibility is temporary, so you want to apply for Medi-Cal to get coverage for services more long term. Next slide. So we have included links to our public-facing landing pages where both you and individuals can get more information about these programs. And for presumptive eligibility, locate a qualified provider. I believe this deck will be shared, so you should have access to those links. Next slide. We've also included contact information for each of the programs just discussed. Ambassadors and the public may contact us via email with any general questions.